This is an update to an ongoing clinical trial for the treatment of breast fibroadenoma. It is an FDA and IRB approved study under the investigational device exemption from the FDA. This study is using ultrasound-guided focused ultrasound ablation. The disclosure I'd like to make is that our study is funded by the manufacturer of the device, which is Theracleon. A little bit of background about the pathology that we're treating. Fibroadenomas are a benign breast tumor. They are not breast cancer. They're very common in the general population, and they're usually seen presenting in young women. Here's the typical appearance of a fibroadenoma on both a mammogram and on ultrasound. Fibroadenomas can be symptomatic. They are a benign breast tumor, as I was saying, and they don't require treatment, but they do occasionally, patients do seek treatment for them because they can be symptomatic. They can cause pain and tenderness. They may even change the contour of the breast. The general management, you can just observe these things, but some women do seek out surgical excision to have them removed. It is noted, though, with surgical excision, there are anesthesia risks and there is a scar after surgery. Here's an appearance of what the breast might look like after an excisional surgery to remove a fibroadenoma. You can see a small scar at the top of the areola in our patient there on the left, whereas a non-invasive surgery then would leave no scar and no change in the cosmetic appearance of the breast. My little clicker here is a little delayed. Okay, so our study is a single-arm study. It's a single-center study. We have enrolled 20 patients. Our primary objectives are to evaluate the feasibility of this treatment. We're looking at tumor response, we're looking at patient experience, and we're looking at safety. The inclusion criteria, we're enrolling women that are 18 years or older. They have a non-calcified fibroadenoma that is palpable. We can see it on ultrasound, and it's been pathologically proven with a core biopsy. Other inclusion criteria are in regards to skin distance from the fibroadenoma. We want to make sure there's a safe distance there from the skin to the focal zone. And there are some limitations with the device for how deep we can treat. Here's a picture of the device. You may have seen it at the table out front. There's a very user-friendly touch screen for the operator, and then this robotic treatment head, which comes into contact with the patient. What happens during the procedure is the patient is positioned very comfortably. We do use IV conscious sedation as needed with Versed and fentanyl. The level of sedation is quite minimal. We do, though, carefully create a nest of anesthesia around the mass with degassed local anesthetic. The transducer is then positioned optimally over the mass. We do targeting and treatment planning in multiple planes. With then real-time observation during the treatment. Here are some images from typical treatment planning. We draw the region of interest around where we believe the fibroadenoma is. We also draw the skin surface, and then the computer generates a treatment plan and shows us the proposed sonication zones. We are primarily treating the inside of the tumor. We're not treating around the periphery. And what happens during the procedure is that there's alternating cycles of pulses of focused energy for ablation, followed by a cycle of cooling. Each pulse lasts a few seconds. We adjust the power at the beginning of the treatment to achieve a visible denaturing of the tissue that we can see on ultrasound. We are not using any internal temperature monitors during the treatment. And then treatment progresses until all the sonification sites have been treated. What happens? What does it look like when we're treating? Sometimes we see the production of a hyperechoic mark at the focal zone. We sometimes can also see boiling of the tissue real time, and we can see edema in the surrounding breast tissue. Here's a couple images of what it looks like when we're treating. Here's the fibroadenoma in the middle of the screen. During the application of the treatment pulse, there is some artifact that's seen on the imaging, and then followed by the creation of one of these hyperechoic marks. The transducer then moves automatically inside that robotic head to then move to a different area, and we continue on treating multiple sonication sites until the entire internal contents of the mass are treated. So our preliminary results here, again, this is preliminary. We're not at the end of our study, but what we can tell you so far is that we have enrolled all of our patients. We're now close to accrual. 10 of our patients have done a full year of follow-up. We have 10 more that are still in follow-up. So far, we don't have any grade 3 adverse events to report. There have been no burns, no persistent skin changes, and no persistent pain at the site. Patients do report having some minimal pain during the procedure, but it's fairly minimal there on a 100-point scale. Cosmesis is excellent, and we do see a reduction in size and palpation. Here's ultrasound images at 3 months showing the tumor decreasing in size. That particular one was almost 70% reduced in volume. So our preliminary conclusions here is that this is a well-tolerated procedure by our patients. There appears to be minimal toxicity, and it does appear to be effective. Thank you.
Exactly on time, perfect. So I'd like to open this presentation up for questions from the audience. If you have questions, please approach the microphones. So I'll start with the first question. Carrie, can you tell us a little bit about some of the difficulties that you've seen in immobilization of the breast?
Yeah, so the breast is a very pendulous organ, and depending on patient positioning and also being pushed on by the robotic head, the breast can move. So one of our early challenges was to figure out how to keep the mass immobilized during treatment so that it remained where the device thought it was. We didn't have to retarget multiple times. So what we found is that the best positioning was to have the patient completely comfortable and have the fibroadenoma parallel to the chest wall such that it was supported by the rib cage. So what that means is if the mass is in the lateral breast, we found it was actually quite helpful to roll the patient into a lateral decubitus position, support her with pillows, and then bring the treatment head directly on top of the mass. And that seemed to work quite well.
Do you treat edema or the edema that is following? And if not, how long does it take to go away?
So we do see edema in patients immediately after the procedure. It's an expected finding there as we're destroying the tissue. Most of the edema that we see peaks around the first follow-up, which is at the first week after treatment. And then by 3 months, we've not seen any persistent edema at that time. And we don't do anything to treat it other than we tell patients they can take over-the-counter anti-inflammatories as needed.
Okay, if there's no other questions.
Thank you.
Oh, we do have a question.
Okay. Sorry.
How do you assess the lesion size after the treatment?
We are assessing it with palpation by the patient and also by a physician, and then we do monitoring with ultrasound at 3, 6, and 12 months. We measure the fibroadenoma in 3 planes.
So, but immediately after the treatment, can you see the lesion on the image?
Yes, we do measurements immediately after. It's not one of our primary endpoints of data that we're collecting, but we do the measurements. And I don't notice a significant change in size immediately after. It's actually much harder for me to see the lesion right after the treatment because it's become more echogenic and less well-defined.
Okay, thank you.